Dr. Vanaja. Yes. Sure, you will.
Role of B-scan ultrasound in preoperative evaluation of posterior segment in dense cataracts. Blindness in South Asia due to cataract is 51%, and the incidence of cataract in India is 0.4 to 0.5%. In patient with dense cataracts, fundus view may be obscured, and B-scan ultrasonography helps in posterior segment evaluation and surgical planning. B-scan is a non-invasive, efficient, reliable, and inexpensive diagnostic technique for evaluation of ocular pathology. Both A-scans and B-scan techniques are important for the diagnosis of posterior segment lesion and give vital information regarding the status of vitreous, retina, choroid, and sclera. There are few studies done to evaluate posterior segment using B-scan ultrasonography in case of dense cataracts. Material and method. This study included 1,005 patients with dense cataract where fundus was not visible. Patient underwent anterior segment evaluation by slit lamp and posterior segment using B-scan. Postoperative fundus evaluated to correlate with preoperative findings. Chi-square test assessed sensitivity and specificity of findings. Results: total 1,005 patients are analyzed. In that, males are 455, females are 550 with diabetes 65, hypertension 147. In that, hypermatures are 249, intumescents are 21, mature cataracts are 730 with Morgagnian is 5. Comparison between the pre-op B-scan findings and post-operative fundus examination. In 1,005 patients, there is normal 944 with asteroid hyalosis 21, fine vitreous opacity is 5, vitreous degeneration 29, vitreous hemorrhage 6, posterior vitreous detachment 38, choroidal coloboma 2, posterior staphylomas 2, tractional retinal detachment 1, retinal detachment 1 with optic disc notch 33. Here the sum of the funduses showing with asteroid hyalosis, optic disc cupping, choroidal coloboma, tractional retinal detachment, vitreous hemorrhage with retinal detachment. Status of vitreous: the sensitivity of the vitreous is 99.5%, specificity is 100%, positive predictive value 100%, negative predictive value 91.8% with diagnostic accuracy 99.5%. Status of VR interface: sensitivity is 100%, specificity is 99.48%, positive predictive value 86.8%, negative predictive value 100% with diagnostic accuracy 99.5%. Sensitivity and specificity of RCS complex is 100%. Positive and negative predictive values are 100% with diagnostic accuracy 100%. Sensitivity of optic disc is 91.8%, specificity is 100%, positive predictive value 100%, negative predictive value 99.69% with diagnostic accuracy 99.7%. Overall results of chi-square test for sensitivity is 95.40%, specificity is 99.23%, positive predictive value 92.2%, negative predictive value 99.56% with diagnostic accuracy 98.90%. Dense cataracts constitute an important cause of blindness in developing countries, including India, and many cases have dense cataract that preclude the visualization of fundus prior to surgery. Under such circumstances, B-scan ultrasonography can provide valuable information regarding structural abnormalities of posterior segment. It helps the surgeon to provide an appropriate visual prognosis to the patient. Conclusion: this study shows usefulness of B-scan as a diagnostic tool to visualize the posterior segment lesion and can be performed routinely preoperatively. Thank you, sir.
So your patients, this was conducted in 1,005 patients.
Yes, sir.
So any change in the course of management was taken up when you found asteroid hyalosis or some other pathology?
So there is a decreased with the normal patient. There is the visual outcome is less than the normal patient, sir.
So you were explaining this to the patients?
Yes, sir.
But what about the macular diseases? See, mainly we have macular problems which cannot be detected by B scan.
Yes, sir.
So
But
what do you
some
do in
of
such case?
the diseases, it is.
I just missed the research question. What was the research question for your study? Because you have done some statistical analysis also, sensitivity, specificity, and the PP. So research question, what was the research question?
It was a research question. you have mentioned all those sensitivities and
We
specificities.
have done a
So,
lot of
so why
analysis.
you have done that? What was the question for that? You were assessing the B scan specificity and the sensitivity, or
Yes, sir.
Yeah, so the question is, before you start your study, so the research question in your mind, so you must be having research questions. So why you want to do this study? So
Because
did
the
you decide
visual
on that?
prognosis to the explain to the patient, it is depending upon the B-scan findings, sir.
okay, fine. Thank you.
Thank you, sir.